That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Hey everybody, welcome back to another episode of Real Health with Brandi and Amir. This is the podcast where we review latest news in mainstream media about health and wellness and, drugs, illnesses, all that stuff. And then we like to give you the wellness perspective behind that, and we'll give you our opinions on what we think. And the purpose of what we do is to help you feel better, get stronger, live longer, and feel younger. You noticed Brandi is back. By the way, I am Dr. Amir Rashidian, a chiropractor. Brandi is my better half, and the reason you probably watched the show, actually.
I think there was good viewership last time. We had Dr. Michael join us,
That's
which
right.
was so fun.
And
I'm sure you guys missed me, but
he did a
he was a
great
good
job.
replacement.
Yeah, he did a great job. He brought some good insight.
Yeah.
And certainly he has a different knowledge base, which is very nice. So we'll probably bring him back at some point. Maybe we'll even do one with all of us.
That would be fun.
Dr. Chris Cole is on our team as well. I think he would have some ideas and opinions.
Yeah. I think that would be
His
great.
wife is a nurse practitioner, and that may be another perspective that could benefit our audience. So down the road, we may have more guests, and we may have more just team members joining you. But I am happy you're here. I'm glad
Thanks.
you're back, because one of the things we promised our audience was that we actually did that article about the oncologist, the cancer doctor who himself got cancer.
Yes.
And then he needed a double lung and a liver transplant, and how that surgery ended up being monumental and groundbreaking, and it actually ended up being very successful, and he's still alive. He's apparently in his 60s and a newlywed as well. So why I bring that article up from last podcast is because the reason he needed the double lung transplant and liver transplant was because the chemotherapy is what injured him.
Yes.
And I know there's an article here today about how you can test to see if chemo is going to work for a patient. Yeah. So I'll let you take that away, because it's very interesting.
Yeah, this was an NBC news article several weeks ago. And, just due to our scheduling, we couldn't get this in. But, man, this really hit me hard. As you guys know, my family history, we have a very deep history of cancer on my mother's side. And so I'm one of the few women on that side of the family that has not been diagnosed with cancer. And so this definitely hits home, and I wanted to make sure that we shared this with you guys. So on one January morning in 2021, Carol Rosen took a standard treatment for metastatic breast cancer. 3 gruesome weeks later, she died in excruciating pain from the very drug that was meant to prolong her life. Rosen, who was a 70-year-old retired school teacher, passed her final days in anguish, enduring severe diarrhea and nausea and terrible sores in her mouth that kept her from eating, drinking, and eventually speaking.
That's awful.
Yeah. And you can, a lot of cancer patients often experience those same symptoms on a milder side, just with normal routine chemotherapy or radiation therapy. But this is to a point that is excessive, and you're going to learn why here in just a minute. She said her skin peeled off her body and kidneys, and her liver failed. Your body burns from the inside out, said Rosen's daughter. So I just want you guys to take a minute and just think about that. Like, you're already in pretty severe pain with a lot of cancers that are, further along. And then on top of that, you end up taking this medication, which is supposed to, and knowing it does destroy a lot of your cells, even your good ones, which is why you feel so crappy when you're taking chemotherapy. But then to have this literally burning you from the inside out, I mean, it's just, you can just imagine how it is, even as a family member, to watch your mother, father, whoever going through that. So Rosen was one of more than 275,000 cancer patients in the United States who are infused each year with fluorosil, known as 5-FU. or in Rosen's case, instead of being infused, instead of having it as an infusion directly into the blood, they take a nearly identical drug in pill form. These common types of chemotherapy are no picnic for anyone, but for patients who are deficient in an enzyme that metabolizes the drug, it can be torturous or deadly. So, what they're saying is there is 1 in 1,000 patients who, if they take this particular chemotherapy drug, their body has an enzyme that does not allow them to metabolize that medication. And so it's staying longer in their body and creating this buildup. So it's increasing like the half-life. Is that kind of what's happening? Or increasing the how long the body takes to burn it off. And so it's creating such a toxicity in these people that it's killing them. So so it's 1 in 1,000 patients who take it, which end up being hundreds a year, are severely sickened and 1 in 50 are actually hospitalized. Those are really big numbers to me. You know what I
agree.
mean?
Especially as a result of something that's supposed to help reduce or
Yes.
shrink a tumor or reduce the
Yeah.
cancer. It's actually causing more harm than good.
Yeah, in which I would say if there were no way to know that, then you're like, well, that's a risk I may be willing to take if that's my only course of treatment. However, there is a test. So there is a test that they can do to see if a patient has that enzyme. And if they find that they do have that enzyme, then they can allow that patient to make an informed decision. Not everybody that has the enzyme ends up having that metabolizing issue. However, if they do, they're much greater at risk, and there's no way to know how they're going to respond. But the doctors could start them with a half dose and then bring them up if everything is okay. But majority of the oncologists are not doing this test or are not willing to do this test. Many patients don't even know that that test exists. So check this out. A survey recently found that only 3% of oncologists routinely order this test before dosing the patients with 5-FU. That's because the most widely followed U.S. cancer treatment guidelines issued by the National Comprehensive Cancer Network doesn't recommend preemptive testing. I guess for whatever reason, they are 100% okay with those numbers and those losses. I don't know why, because I would never be okay with that. The FDA, although we totally know we don't always trust what they authorize or approve or disapprove, the FDA added new warnings about the lethal risks of 5-FU to the drug's label on March 21st, following queries from KFF Health News about its policy. KFF is Kaiser Family Foundation. It is a nonprofit that deals a lot with health reform and health policies and things. They are not affiliated with Kaiser Permanente, just to let you guys know. That is a different entity. There's no relationship there. It did not require doctors to administer the test before, and this is the FDA, does not require the doctors to administer the test before prescribing the chemotherapy. The agency, the FDA, who's planned to expand its oversight of laboratory testing, was the subject of a House hearing also on March 21st. And it said it could not endorse the 5-FU toxicity test because it's never reviewed it. I can tell you, I reviewed just a little bit of information they put in this news article, and I would 100% say you either need to offer that to patients routinely or you just need to do it. And why you wouldn't even allow a patient to make that determination is beyond me.
It should be standard protocol.
Yeah, that to me is malpractice. I think that should 100% be, if you know that there is a test which will tell you whether or not there's a medication that will treat that patient or kill them. And here's the kicker. I'm going to skip down just a little bit. Are you guys ready for this? The cost. Most U.S. insurers, private and public, will cover the test, which Medicare reimburses for $175. Mm-hmm. This is not a test that costs thousands of dollars, people. So, I mean,
most patients could just afford it out of pocket too.
Yeah. Here's my challenge with this is, we have people, sitting on panels they're supposed to be reviewing this. We know that we have a few great oncologists out there that really are going to put the patient before the treatment. And I think that's super important. Most of the oncologists who were asked about this, they're like, well, you're tying my hands. Like if I have to test every patient, then I might be taking away a treatment that will work. Well, you're also potentially taking away a treatment that could
Hurt them.
So why not know? I just don't know why we want to have our head in the sand. Oncology, they say, is not the only area in medicine in which scientific advances, many of them taxpayer funded, lag in implementation. For instance, few cardiologists test patients, are you ready for this, before they go on Plavix. Everybody's heard of Plavix.
That's a blood thinner.
And it's a brand name for an anti-blood clotting agent. Although it doesn't prevent blood clots as it's supposed to, in a quarter of the 4 million Americans prescribed each year.
A quarter.
A quarter.
So 1 million out of the 4 million, 1 million of them are not getting any benefit from the drug.
Correct. And I guarantee you they're still getting the side effects. And that's what's mind numbing to me, is that we're willing to put these people, 1 million people is not a small number. A quarter of a population on this medication do not warrant benefit, which means they're not protected in a way that the doctor says they are, and they're at greater risk. I just don't.
I mean, doctors are sworn to do no harm. It's part of the Hippocratic oath, and if they're not testing to see if they're doing harm, then they're breaking their oath.
I 100% agree. I guess the fact that it was Carol, right? Carol Rosen, who unfortunately, the school teacher who passed away after not being tested appropriately. Her daughter was obviously grief stricken after this. She wanted to sue the hospital. She wanted to sue the oncologist, but she realized that's not what her mom would have wanted. So she's been really pushing and advocating for this routine testing to be done. So, I love when I hear about people taking a situation like this and really turning it for good. Sometimes, and I'm not one that wants to just jump out and sue people, but I go, sometimes maybe that's what it's going to take in order for us to pull our head out of the sand.
Well, at least her story's being heard now.
Yes.
And it's published and printed. And
yep, for sure.
About.
So, if you are one of those patients who unfortunately are going through cancer treatment, ask your doctors, ask them, say, what tests can we take to make sure that this works for me, that this works for this type of cancer, and that my body is going to be okay with this. It never, you should be advocating for yourself, because you cannot always count on your doctors.
What was that test again? Because I know a lot of doctors will say there is no test.
Yes. Well, maybe what we can do is put it in there as well. It's a, I don't know if I can pronounce it properly, a fluoropyrimidine enzyme deficiency is what they're looking for.
Okay.
So, yep. So we got to make sure that we can get this genetic testing done, so that we can see, who has this enzyme, and make sure that patients aren't being injured. Yeah. I had just so happened that there were 2 other cancer articles that hit our desk for this week as well. One is Everyday Health, and one was in Natural Medicine. The Everyday Health FDA approves first cell therapy for advanced melanoma, and the other was Medical News Today, cancer vaccine with immunotherapy shrinks liver tumors, the trials show. So they are coming out with a lot of new treatments, and some of the treatments they're calling, genetic vaccines. Some of them,
typically, by definition, a vaccine is supposed to protect you against getting something.
I agree. But, I just looked up, and they have literally changed the definition of a vaccine. And so it no longer states that at all. So what we used to know as a vaccine is not labeled as that anymore. Because I too, and that's why I started looking that up, because I'm like, why are they actually calling this a vaccine? Um, and it's a genetic vaccine.
Wow.
It's so they're actually taking and creating, along with the immunotherapy, they're creating a very specific medication, which is supposed to go right into the cell, and the immunotherapy is supposed to help this vaccine, the cells live longer. Because I guess what happens is a lot of times the cell that's trying to go in and fix the bad cancerous cells, it gets exhausted, and then it can't totally get rid of the cancer. So these two things together are supposed to help shrink tumors better, and for that one cell to not get tired so that it can begin to fight off more of those cancer cells. Um, Here is my biggest concern, and um, I don't know if I need to go all through these. I mean, the one Tagavi is the new melanoma FDA approved um, medication that is now available for melanoma. They are now using tumor infiltrating lymphocytes therapy, which is now called TIL, along with the drug that they're using, Amtagavi, which they say it works by deploying immune cells inside the person's tumor to fight their cancer. It's approved for adults with unresectable or metastatic melanoma. So if that melanoma has spread into areas or organs that they cannot take it out, then this is one of the newer treatments where they had very little that they could fight before. They're now saying, hey, we now have this and we're getting a little bit better of a result. It's not massive, but it is a little bit. They're actually saying that all the patients receiving the TIL therapy experienced serious side effects, though. And so what's really hard is that, yes, you have you may see like a 30% reduction in the tumor size. Um, 1 in 5, I think 1 in 5 of them experience complete remission. But really only about half of the patients in this study received partial remission. But the side effects are atrocious. And so um, y- I don't know. Sometimes I don't know if the small increase compared to the horrible side effects that people are experiencing are a true benefit. But the one thing that I don't understand is why the FDA is struggling to approve an enzyme related test to increase the safety of some of these, but they're willing to like give FDA approval for these that have all of these side effects. Why can we not get FDA approval for the testing, that we were talking about in the prior? I just don't understand why.
So typically when something is discovered and they want to get FDA approval, they do the research, which sometimes costs money because they want an independent company to do
Right.
the research, which is more accurate. But then they have to take 3 positive results, submit those to the FDA, and that submission comes with a hefty check.
Mm.
And so it has to be there has to be enough profit for the people who are administering the test or creating the test kits to be able to have enough of a profit. So if it's a $175 test and it's a one-time thing and you don't ever have to need it again, versus a drug where someone is going to stay on and take a pill every day for
Right.
the rest of their life, and where they live 10 years or 20, 30 more
Yeah.
years,
There's a more economic
there's
drive.
that
Yeah.
that's a recurring revenue, and so they're much more willing to pay the money and do the research to send it to the FDA for their FDA's
You're right.
approval. And I wish the FDA had different fees for different types of things. I don't know how that
Yeah.
works, but it just seems like their interest
Yeah.
is not in public safety when it
No.
comes to
I mean,
something like this.
we've seen that time and time again. The I'm not going to go through all of the cancer vaccine with immunotherapy shrinks liver tumors in trial. The trial shows that, yes, they're seeing some improvement on the liver cancer as well, which This particular HCC, which is hepatocellular carcinoma, accounts for 80% of all the liver cancer cases. Um, while this is great, again, new therapy is wonderful. Can I just point out that these cases or these types of cancer that we're talking about, they're creating all of these new vaccines, all of these new treatments. Nobody in any of these are talking about how to prevent. So taking the more holistic approach, just so you guys know, the causes of HCC, of this kind of liver cancer, which is the most common, which, by the way, researchers estimate right now that 905,000 people were diagnosed with liver cancer in 2020. That number is expected to hit 1.4 million by 2040. Okay, and you go, why would there be such a rise in this type of cancer?
It's huge.
Let's talk about the causes.
It's basically over a 50% increase.
Correct. So obesity, can we control that? Smoking, drinking, is that something that is controllable? Long-term viral infections like Hep B or Hep C going untreated. Diabetes, controllable. Foods that have aflatoxin, which is a fungus that grows in grains and things like that. So every single thing that was named, and there's a couple others, all lifestyle. So that means if we want to truly change these numbers, then we have to deal with these other things. We have to deal with the population that's struggling with obesity, not just putting them on Ozempic, but actually helping them figure out how to deal with this outside of some of those pharmaceuticals. Smoking and drinking, pretty easy. I'm not saying it's easy to stop, but it is possible.
Yeah, but that's why we talk to our kids all the time.
100%.
There's several things that'll ruin your life. 2 of them are smoking and drinking.
Yeah.
So and the kids know their list. If I say what are 6 things that'll destroy your life, they'll list it out.
They will. So just, do some extra research. If you have friends, family members, or you just want to say, hey, I want to sidestep some of these things. I don't even want to have to be one of those people that need to be tested to see if I have that enzyme, or I don't want to know how my body is going to respond to that cancer treatment. I 100% am with you. Then it's time to start looking at what you're doing every day in your life.
You put your seatbelt on before you start driving, not after you crash your car.
People brush their teeth every day, right?
Yeah.
Why? Because we don't want to end up with things like cavities and having infections at the nerve root.
Well, I think the main reason everyone brushes their teeth is because they don't want bad breath. But
I think that's why we all want everyone else to brush.
The reason you should brush your teeth every day is because you want to prevent cavities and gum disease and all kinds of other stuff. So what do you say we change gears a little bit?
Let's do that.
Let's talk about heart health. And New York Times has an article that said, "Are you eating too much salt?" And just like
my children would say, you can never have enough salt.
just like everything when it comes to health, you cannot say one thing causes one thing. The monocausal theory of disease is obsolete. It does not work. Even the germ theory has failed. You say this germ causes this disease. Well, 10 people can get exposed to it.
Correct.
And 9 of them might even get the disease, but 1 won't. So you can't say that theory is true across the board. For something to be true across the board, it has to apply to 100% of cases. Now, if you take an axe to my arm and you take it to 10 other people's arms, it will have the same result.
Correct.
So that applies. But you're telling me salt causes. So anyways, I have a problem with that. Sodium is not a bad thing. Sodium is necessary for health. And the article does mention that. So in New York Times, are you eating too much salt? Without sodium, you wouldn't be able to survive. Nerves would fail to fire. Muscles wouldn't contract. But experts say that most people consume far too much of it, increasing the risk of high blood pressure and heart disease. And again, I go, sodium doesn't just come from salt.
Right.
There is lots of things there that have way too much sodium in it, and it's not salt. So, in the United States, for instance, about 95% of men and 77% of women consume more than 2,300 milligrams per day, a limit federal health officials recommend. So, everyone's recommending 2,300 milligrams a day. But in recent decades, researchers have disagreed about exactly how much sodium is too much, with some suggesting that federal guidelines are too strict. So they discussed this with several doctors, and I may name some of the doctors as we go through. In a 2021 review of 85 clinical trials, for example, scientists looked at what happened to people's blood pressure when they consumed 400 to 7,600 milligrams of sodium per day. As their consumption increased, the researchers reported, so did their blood pressure. The effect was strongest for people who already had blood pressure, but the researchers also saw it in people who didn't. So if you had high blood pressure already, consuming too much sodium increased your blood pressure even more. Nearly half of adults in the United States have high blood pressure. Half of adults in America have high blood pressure. That
According to what they say is high blood pressure
exactly,
right now, which
because
is a whole other conversation.
it used to be 140 over 90.
Mm-hmm.
Then there was 130 over 80. Then it was 120 over 70. Nearly half. Okay. And researchers say that all of the problems with our diets, of all the problems in our diets, sodium is the most harmful to global health. Excessive salt consumption causes close to 2 million deaths each year, they estimate, mainly from cardiovascular disease.
I want to say, I would like to know of the group that they were looking at too, what was their water intake?
Yeah.
Because I know my body functions very differently when I have a higher amount of sodium and my water intake is low versus I'm drinking my gallon of
Yeah.
water. I know a gallon of water, it's a lot, but it's necessary. You
Yeah.
know what I mean? Most people don't even get a fraction of that in.
Yeah, most people get 2-3 cups of water a
Right.
day. And
So I think that's part of the impact as well.
yeah, so according to U.S. dietary guidelines, adults should have no more than 2,300 milligrams, equivalent to about 1 teaspoon of table salt per day. The World Health Organization and International Society of Hypertension have a slightly lower limit at no more than 2,000 milligrams per day. The American Heart Association says that while no more than 2,300 milligrams per day is a good target to aim for, it's even better to avoid going over 1,500 milligrams per day, especially if you already have high blood pressure. Again, people, if the only cause of high blood pressure was sodium, I would say, yeah, let's cut back on
Right.
sodium. It's not.
Right.
You're looking at other physical characteristics of sedentary lifestyle. I mean, if I sit all day, then getting out of the chair to walk to the refrigerator to get my next beer is cardiovascular activity, and during that walk my blood pressure will go up. Just like
As it should.
if I have an active lifestyle and then I get on a treadmill and run, my blood pressure goes up. It should go up. But to these people who are not used to activity, a little bit of activity raises their blood pressure. So, of course, they say they have high blood pressure. But then there's psycho-emotional factors.
I was just gonna say
There are
that.
some seriously angry people out there. And then there's other chemical factors and metabolic issues and so on. There's too many different factors. So I don't like how they put a number on this and say, oh, if all you do is eat sodium, consume less than 1,500 milligrams of sodium per day, your high blood pressure will not be an issue.
And in theory, if sodium was the only monster, right,
Yeah.
then why would we not limit the sodium that's allowed in prepared foods?
Right.
Because
Processed stuff.
yeah, our prepared processed foods, I mean, if you're not making stuff from scratch, you cannot control the sodium intake. So, but I don't see what are the restrictions.
Salt is the strongest preservative.
Right.
That's why like canned food has tons of salt in it.
Right.
You know, they recommend rinsing it. If you eat stuff in a can, rinse it a couple times to get some of the sodium off. It says, but not all experts agree. And several studies published in the last decade or so For instance, researchers reported that it was only people who consumed much more sodium, on the order of 5,000 milligrams per day, who had a greater risk of heart disease or earlier death. Main issue is that they could not accurately measure how much sodium people consumed, which is my other issue. Is
Yeah.
you're like, okay, there's probably sodium in some natural stuff, just
Oh,
like
I'm
there's
sure.
potassium in natural stuff.
I'm sure there
By the
is.
way, they talk about potassium, I believe, in a 2022 analysis. Dr. Who, HU, not like
Oh, I was like, ooh, I remember that show.
not Doctor Who, but this is a different Doctor Who, Dr. HU, and his colleagues compiled the results from studies that used more rigorous methods among 10,700 adults who were followed for nearly 9 years. Most consumed between about 2,250 and 5,250 milligrams per day, so between 2,000 and 5,000 milligrams a day. The researchers found that those who consumed the least amount of sodium had the lowest risk of cardiovascular disease, and as sodium consumption increased, so did cardiovascular risk, a finding that supports the U.S. guidelines. Now, do you know that and I'll tell you this, but I'm not telling you to do this. I work out really difficult workouts. But today my workout was an hour and 45 minutes, an hour and 48 minutes, and most of it was weightlifting and lots of sets, heavy weights. And it's a program my coach designed for me, and this is my biggest, heaviest day. And so one of the things I have to do is, in the water that I drink, I have to dissolve a teaspoon of salt. Well, according to them, that's my whole allowance for the whole day. But I know I'm going to be sweating out a lot of
Yeah.
minerals.
Yeah.
And pink
need to
Himalayan
replenish.
salt seems to have the minerals to replenish my electrolytes so that I don't pass out during these workouts.
Right.
And it's been extremely helpful. So the need for sodium changes depending on activity and
100%.
lifestyle as well. And my coach wants me to put 1 gram of salt on every meal that I eat. Now, I eat 7 meals a day right now. 5 of those are solid foods,
Yeah.
and 2 are protein shakes. So on the 5 solid foods, I'm supposed to put additional salt. Plus, whenever I have big, heavy workouts, I need to add another teaspoon of salt. And my blood pressure is low. Now, when I was in chiropractic school, when we did the heart thing, the rotation, studying cardiology, our instructor said that only 5% of the population is sodium sensitive when it comes to heart. So what they would actually do, and we would do this in clinic, was to find out, we'd give someone salt and check their blood pressure. If it went up, that means that person is sodium sensitive. And if it didn't go up, that person is not sodium sensitive, and they didn't have to cut.
Do you remember how long of a time between taking and
I
checking?
think we would dissolve salt in water, like a teaspoon of salt in like 6-8 ounces of water, and they would drink it, and then we would check their blood pressure every 15 minutes.
Very good.
And if you got a spike, from where obviously we would check blood pressure prior also a couple of times, and if there was a spike, that means that person should limit their salt. That's a test you could do at home. Now, if you already have high blood pressure, don't do this test because your blood pressure might go up too high.
Right.
But if your blood pressure is low or below the limits and you want to test this, it's not a bad test.
Right.
Eat some salt. Check your blood pressure every 15 minutes. See if there's a spike. If it jumps up, don't drink the salt and be active. Sit somewhere. Just sit and relax and see if your blood pressure goes up by not being active. So conflicting results are common, but the evidence to support reducing sodium consumption to the recommended level is pretty darn strong, is one of the doctors who says. And Dr. Who added, I don't think we should wait for perfect evidence to take action. If you have high blood pressure, reducing your sodium consumption will most likely help lower it. And Dr. Deepak Gupta, a cardiologist, that was by Deepak Gupta, excess sodium throughout life can gradually damage blood vessels and eventually lead to high blood pressure. It has a cumulative effect.
But again, they don't really know what is considered overconsumption because there's such mixed reviews on.
So they did give a recommendation, which I actually like. They said, most people eat 2,000 calories a day. So if you're getting a box, processed food, and you absolutely have to eat processed food, and you look at how much sodium is in it, if the milligrams of sodium is higher than the number of calories in a serving, don't do it.
Oh, that's a nice
Because
baseline.
that way you keep your calories and your milligrams of sodium around 2,000, because you're naturally going to eat about 2,000 calories a day.
Right.
You're able to keep those the same. So that's a good way of checking to see if you're taking too much sodium. They talked about potassium, which is very important. At the same time, these and other studies have shown that getting enough potassium may be just as important as cutting back on sodium. Dr. Shute said, getting adequate potassium from your diet can reduce your risk of high blood pressure and heart disease, in part because potassium helps your kidneys remove extra sodium from your blood. But some people should avoid consuming too much potassium. If you have kidney disease or are taking certain medications like potassium-sparing diuretics, check with your doctor before increasing your consumption. Dr. Shute said, and those who are prone to low levels of sodium in their blood may not want to adopt a low sodium diet, she added. Potassium rich foods are some of the, the minute you say potassium, people think banana. But that's a lot of sugar. It's a lot of fructose. Dried apricots are a good source of potassium. And avocados actually have good sources of potassium and fatty acids. So Dr. Hu also says any reduction in sodium should be helpful for most people. In the United States, about 70% of the sodium people consume comes from processed foods and dining out, according to the FDA. So cook your meals at home. Don't eat out as much. Vegetables, fruits, beans, nuts, and dairy products are all rich sources of potassium, and eating more of these foods can boost your potassium while also probably reducing your sodium. And of course, they don't talk about magnesium, which has a relaxing effect on your blood vessels as well.
It's so important to many things.
And we did a whole podcast on magnesium where we talked about the different types of magnesium and what each one was good for. So go back and watch that. Adding flavor to your food by using more herbs and spices and less salt, like spicy seasoning like chili pepper, acids like lemon and vinegar can enhance the taste of salt, making a little bit go a long way. And then they also said the Mediterranean diet is very good for cardiovascular health, which I agree with.
Awesome.
So I think we're out of time. Do you want me to list the cities that have the highest allergies real quick?
Yeah, we can do that.
Okay, so article came out in USA Today because it's allergy season, and I thought we'd mention this. Spring is particularly difficult for the 80 million people who suffer from seasonal allergies. So they rank these cities based on.
Where are we?
I don't think we're listed on this.
Oh.
But the worst places to live with seasonal allergies. Number 1, Wichita, Kansas.
Wow, that's like my next door neighbor.
Yeah.
So I'm from Hutchinson, just in case.
Hutchinson is next to Wichita, so
we're like now it was like 30 to 45 minutes apart. No, I've never really suffered from like major allergies.
Worst place to live with allergies is Wichita. Then it's Virginia Beach, Virginia. That's close to us, but still 4 hours away.
Yeah.
Greenville, South Carolina.
Okay.
Dallas, Texas is number 4. Oklahoma City is 5. Tulsa, Oklahoma is 6.
Whoa.
Richmond, Virginia, that's only 2 hours from us, is number 7. Des Moines, Iowa is 8. Raleigh, North Carolina is 9. And number 10 is Fayetteville, Arkansas.
Wow.
And then they talked about the longest season. So these cities had allergy season that had lengthened since 1970. They say the reason allergy season is lengthening is because spring comes sooner because of global warming and climate change.
Really, it has nothing to do with the chemicals we spray on all of the plants and the pesticides and all that?
Yeah, and according to USA Today, it's only because of climate change and nothing else.
Wow.
Reno, Nevada has the longest allergy season of 95 days. Las Cruces, New Mexico, 65 days.
Wow.
That's a 30-day difference.
That's huge.
They have a month more of allergies in Reno than they do anywhere else. Medford, Oregon, 61 days. Boise, Idaho, 51 days. Tupelo, Mississippi is 50 days. Missoula, Montana, 48 days. Myrtle Beach, South Carolina, 48 days. El Paso, Texas, 47. Toledo, Ohio, 45. And number 10 is Eugene, Oregon at 40 days, which means us in Maryland, our allergy season is less than 40 days.
Wow.
That's interesting. I thought it
Yeah.
was
I
longer than
think
that.
for some it doesn't feel like that.
Yeah, they did talk about the immune system and how mast cells produce histamine when they're irritated, and how the body thinks some people's body thinks that pollen is a bad thing, like a virus, and
Mhm.
they unleash an immune response. And so you wanted me to mention that there are some supplementations you can take. There's a company called Standard Process that has a lot of supplements. Also, there's a company called Doctors Research. Both of those companies distribute their products only through healthcare practitioners, which I like, because you shouldn't be able to go and just buy these on your own. But there are
It
products.
also ensures that they're actually doing the testing. In order for them to be considered a professional grade, they have to be willing to put their money where their mouth is.
Right.
And so for us, we want to know that what's in the bottle, what you have on the label,
Yeah.
is actually in the bottle. So they give us that assurance through their internal external
Right.
testing, which most of the stuff you get online or on the supermarket shelf, you're not getting
So
that.
I'm against antihistamines for the reason that they only block the H1 receptor. The H2 and H3 receptors get hit with more histamine, which means the runny nose, itchy eyes gets less, but you end up with more digestive issues, more emotional issues like anxiety and depression.
And most people don't even know that that's what happens
Correct.
with, with those
Now we have
receptors.
videos on our YouTube channel that goes into detail about allergies, but there's two types of supplementation. One affects the mast cells and reduces the production of histamine, which seems like a good idea.
Mhm.
So less histamine in the body, less receptors get hit, less allergy response. The second type actually uses your liver to excrete histamine from your body. And there's also one that helps with symptoms, which is an acidifier of the body. When you acidify the body just slightly, it reduces mucus production. So talk to your healthcare practitioner or do a search to see who distributes Doctors Research products and Standard Process products, and they'll be able to help you pick a
And you
product.
may see those on well-known websites where you can buy everything, but it is actually not recommended. Sometimes those are resellers. You may not actually be getting what you think you're getting. So even the companies, Standard Process and Doctors Research, do not typically recommend buying them online unless you know they're coming straight from the company, but
Yeah.
they do hike the prices up to keep you from doing that. So if the price is astronomically higher than you'd get from your physician, there's a reason. They don't really want you to purchase it there. So if it's cheaper, guaranteed, you might be running the risk of getting a knockoff and not knowing it. So
Correct.
be cautious.
Correct. All right.
And maybe we can ask Sean to put a link to some of those allergy videos
Yeah,
so that they
and
can follow those.
and that would be fantastic. Guys, tune in next time because we're going to talk about longevity. We have a couple of articles on why we age and how do we slow the aging process. One of the reasons we do the podcast is
Yeah.
feel better, get stronger, but live longer and feel younger. So let's really dig deep into those. Please tune in and watch that next episode. And for now, we took a little extra time. We apologize, but Brandy's back, so we had to talk a little more. So thanks for joining us. God bless you. We're so thankful you join us. We're grateful for your comments. If you share, we appreciate that. If you decide to like and subscribe, that would mean the world to us. But if not, just tuning in, just listening, we appreciate that. So thank you so much.
Thanks.